let's go through the pathology of tissue repair. So in acute inflammation, there's either regeneration or healing, and in chronic inflammation, there's fibrosis or amyloidosis. And there's a difference between regeneration and repair, as we'll go through in a couple slides. But first, it starts with hemostasis. So there's going to be a fibrin clot formation, and then there's going to be the inflammatory phase, where there are more cytokines released, and there's going to be recruitment of a lot of cells, and those are usually the neutrophils, the macrophages, and the monocytes. And then in the proliferative phase, there's going to be re-epithelialization, vascularization, and granulation tissue will form. So this is going to be acute. The myofibroblasts will activate, putting down like collagen fibers, and the wound will contract. And then in the remodeling phase, the collagen is going to be cross-linking, and then the extracellular matrix is remodeled, and the scar forms. So let's go through it. Regeneration only occurs in certain organs, such as the liver, the skin if the scratch is very shallow, and in the mucosa. And it requires the basement membrane in order for the regeneration process to occur. And it requires cells that are capable of dividing. So regeneration doesn't occur in the brain or in the muscle cells, because the neurons and the myocytes are permanent cells. They are terminally differentiated. So as you can see here, the hepatocytes will go through both hypertrophy and hyperplasia. And then the stem cells will have de-differentiation and redifferentiation. So what does that mean? It can differentiate into something, and it can revert back to stem cells. So it's a unilateral division. So part of it is going to be conserved, and part of it is going to be differentiated. So tissues are going to be classified as labile, stable, and permanent. Of course, the continuously dividing labile tissue are the stem cells. And then cell proliferation is going to be controlled by the cell cycle, stimulated by growth factors. And then it's triggered by cytokines and growth factors in response to loss of a certain tissue. So in the liver mass. And in different situations, regeneration can occur by proliferation of surviving hepatocytes or whatever cell it is, or it can be repopulated from the stem cells. So these are going to be the cyclins. This controls the cell cycle. So when the cyclin-dependent kinase 4 interacts with cyclin D, it allows the cell to go from G1 to the S phase, and then from this CDK2 binds to cyclin A, and then allows the cell to go to G2, and then the CDK1 binds to cyclin A, goes into M, CDK1 will bind to cyclin B, and then mitosis will occur. And all of these are checkpoints to make absolutely sure that the DNA is being replicated correctly, along with the amount of organelles. So the G1 checkpoint, there's going to be a check for the size, the nutrients, any DNA damage, and if the growth factors have stimulated the cell to go through to the next phase. In the intra-S phase, there's going to be checking for DNA damage again, and if this will start the DNA replication. For the G2, it's like the final check. There's going to be a check for the cell size, the amount of organelles, and the DNA replication again. And then in M phase, this is the spindle assembly is going to be formed, and then the chromosome will be attached to the spindles. So like I said, there's going to be the asymmetry of cell division. So there's going to be some cells that are remaining as stem cells, and then the others that will differentiate in whatever cells that it needs. It occurs in the labile cells. Stable cells are always in G0. They have some ability to regenerate, but they are limited. And like I said, permanent cells are the neurons and the skeletal cells. So the liver is one of the special organs that can regenerate itself, and it's triggered by cytokines and growth factors, and can go through the repopulation, and the cells will either go through like hyperplasia or hypertrophy. In the priming phase, the cytokines are going to be made by the Kupffer cells, and they act on the hepatocytes to make them sensitive. And then the sensitive hepatocytes will respond to the growth factor. So the growth factor phase will stimulate the hepatocytes to go from G0 to G1. And then when the cells have, made enough, the liver will go through termination, and then the hepatocytes will return to quiescence, so they'll go back to G0. Chronic inflammation is when angiogenesis will make new vessels. Remember, there's going to be migration, proliferation of vascular endothelial cells in order to make the new vessels. Deposition of ECM will form the granulation tissue, and that will be made out of fibroblasts and loose connective tissues. The maturation and organization of the fibrous tissue will become fibrosis. That is not regeneration, that is remodeling or scarring, and that results in amyloid formation. So this is the specific staining for amyloids, and interleukin-17 will recruit neutrophils and monocytes, just as a reminder. So the ECM is the scaffolding for tissue renewal, is the integrity of the underlying stroma of the parenchymal and basal membrane, and that is really critical for the regeneration process. It establishes the tissue microenvironment, and it stores and presents regulatory molecules when needed. Fibrosis is going to be the formation of new blood vessels. Like I said, there's going to be the migration, proliferation of fibroblasts and endothelial precursor cells, and that comes all from the bone marrow. In the end, there's going to be maturation and reorganization of the collagen tissue. The fibrous scar will provide enough structural stability to still function, but it doesn't go back to like the original level of function. So tissue repaired is going to be replacing the damaged tissue with connective tissue, and there's the scar formation in the injured tissue, and that is only in the cells that are, or in the tissues that have the cells that aren't able to proliferate, or if the structural framework is damaged and can't support regeneration. The main components of the connective tissue repair of angiogenesis, migration, and proliferation, they're going to be the fibroblasts and the vascular endothelial cells, collagen synthesis, and connective tissue remodeling. And the repair by connective tissue always starts with the formation of the granulation tissue in the acute phase, acute inflammation, and it ends in the laying down of the fibrous tissue. So TGFB is a potent fibrogenic agent, and the ECM deposition will really depend on the balance between the fibrogenic agents, the metallomatrix proteins, and the TIMPs. Okay, so in wound healing, there's going to be 4 phases: hemostasis to stop the bleeding, inflammation, proliferation, so this is the angiogenesis, and remodeling. So in first intention healing, it's usually in the skin, it's the coagulation pathway. So the injury is small, there's not a big difference between the edges, the clots will form, fibrin will be put down, and then fibrin contracts, tissue will be pulled together, and the edges will heal. There's going to be like a minimal amount of fibrous tissue there. Like, it's still there, but you can hardly even see it. So in second intention, this is where a scarring will occur. So it's a scarring plus regeneration. So it occurs in the larger wound, and the inflammation, of course, is much higher than in first intention healing. Granulation tissue will fill the space, full of like epithelial cells and scar tissue. Neovascularization will occur, and then the new vessels are going to be somewhat like fragile, and plasma proteins and fluid will go into the extravascular space, forming not just erythema, it will form the edema. The fibroblasts will come in, make the ECM proteins and collagen, and blanching will occur when the collagen deposition is done, and the vascular channels regress, and then the scar will form. Third intention healing is delayed or secondary closure, and it occurs when there's either poor nutrition, poor circulation, or it's purposeful to allow drainage, especially of ulcers or infections in things that are anaerobic bacteria, and this will make the most connective scar tissue. So in third intention, you have to suture the wounds together for it to heal. So just to repeat myself, cutaneous wound healing, there's 4 phases. There's the hemostasis, inflammation, granulation, and remodeling. And wound healing is always going to be altered by infections or diabetes. Excessive production of the ECM will cause keloids in certain populations. So people of African descent, people of Asian descent, people of Hispanic descent, they are more prone to forming keloids. And keloids can be treated with corticosteroid injections. And if the keloids are too large, they can cause a lot of functional impairment. That's it for now. Thank you for your attention, and good luck studying.